Hey guys, welcome back to another video. If this is your first time coming across this channel, my name is Darius Glenn. I'm a registered nurse, and today we're going to talk about why we use paralytics. But first things first, make sure you guys smash that subscribe button and give this video a thumbs up. So, what are paralytics? Paralytics are a neuromuscular blocking agent, meaning they block the neuromuscular transmission at the junction, causing paralysis of the skeletal muscles. I know, sounds a little scary, right? But let me tell you why they are used. So, paralytics are most commonly used in the OR for surgeries to keep the patient from moving around. You don't really want to be awake moving around when there's a neurosurgeon with the scalpel in your brain. It's also used to help intubate patients. So the reason why I'm making this video is because we use them in the ICU, and some of you might think that's really uncommon. You might not have ever guessed, well, that's really weird. Why would you use a paralytic in the ICU? And today I'm here to tell you why. Due to this whole COVID thing, we are actually using a lot more paralytics, and the reason for that is, the whole reason why we want to use paralytics in the ICU is for the patient to become synchronous with the ventilator. So a lot of times patients, we have on propofol, we have on fentanyl or maybe Precedex to help calm them down, keep them relaxed. So imagine, like when you're intubated, you have a breathing tube down your throat, which is very uncomfortable. So we like to use sedation to help, keep you calm and relaxed. So having like high settings, or let's say you're just not tolerating the ventilator, we give you more sedation, we give you like as much as we can. And if you just still aren't tolerating it, we will paralyze you. So the reason why we paralyze you is, like I said, so you can be synchronous with the ventilator. So just as an example, my patient last night, we had him maxed out on propofol, we had him maxed out on fentanyl, he was on Versed, and he still was over breathing the vent. So his vent settings, he was on a PEEP of 16, which is extremely high. Okay, he's an FiO2 of 90%, and his rate is set at 18, but he's breathing 24 and above. Okay, so he's over breathing the vent. He's a COVID patient. He's not even a big guy, but it just took a lot to put him down. So we introduced a paralytic so that way he can no longer overbreathe the vent. So when you're paralyzed, your diaphragm is paralyzed, so you cannot breathe. So now the ventilator is doing all the work for you. However, before we paralyze a patient, it is extremely important that we use the train of 4. And the train of 4 is a tool that we use to monitor the level of paralyzation so that we do not over paralyze the patient and cause unnecessary muscle atrophy. Another very important tool that we use when a patient is paralyzed is called the biceptral index, also known as the BIS monitor. And the BIS monitor is what we use to monitor the level of sedation. Because the patient isn't able to move, they're paralyzed, we can't really tell how sedated they are. So we use the BIS monitor, and it's there's a little tab that goes across the patient's forehead and down to the temporal, and it monitors the brain activity. Typically, we like a range between 40 to 60 based on the doctor, based on protocols. But we usually monitor between 40 to 60. The lower the number, the less brain activity. The higher the number, the higher brain activity. So we kind of want you a little bit less than half, maybe a little bit more. So 3 of the most commonly used paralytics in the ICU are rocuronium, succinylcholine, and vecuronium. And without getting way into details about structural compound of the medications, basically rocuronium, also known as ROC, and succinylcholine, also known as SUX, those 2 are shorter acting paralytics. So we usually use them in emergent intubations, or maybe like I said, in the OR, you push those, very quick acting, it paralyzes the patient, and then you can intubate the patient. And then vecuronium, also known as atracurium, that is a continuous sedative. So for someone like me in the ICU, we have patients in there forever. We run that through the IV pumps continuously at a certain dose. So that one obviously is longer acting. But that's just a quick little video I wanted to make for you guys. There's more information out there, there's more detail when it comes to paralytics, but I just wanted to make something really quick, fun, hopefully easy to learn. If you guys enjoyed this video, make sure you subscribe, hit the like button. I enjoyed making it for you, and I'll see you guys next time.